Okay, so now we're on section 8. This covers what medications you're taking overall. Keep in mind that you may not know specifically all the answers, but you can come back to another time to answer these. Just use your login and password. So let's go through this together. This is asking what medications the participant is currently taking. These are listed by both their generic names and brand names, so read through carefully to find yours. I'll click off prednisone and Remicade. There's also an option for no medications currently taken. If you've read through these carefully and can't find the medication you're currently taking, there's also a box down here for other, and you can type it in. What other medications have you been prescribed for the effects of sarcoidosis and treatment of side effects? So I'll click anti-anxiety medications and vitamin D. Again, there's a box for other. Does the participant take any medical foods or follow a special diet for the treatment of his or her rare disease? This includes something like a gluten-free diet or an inflammation diet. I'll say no. Has the participant had any of the following surgeries to treat his or her rare disease? Heart transplant, liver transplant, lung transplant, things like that. There's also a box for other. I'll click none. Does the participant use any type of medical or assistive device to help them move around, communicate, or do things, such as a cane, oxygen, walker, wheelchair, or other? I'll say oxygen. That's the end of section 8, so we can now move on to the next section about the effects of the disease. Section 9 is about the effects of the disease. How has sarcoidosis affected your lifestyle, family, work, relationships, and more? Let's go through this one. What is the participant's employment status? Employed full-time, part-time, disabled, unemployed, student, or unsure? I'll say employed full-time. How many days of work did the participant miss due to the diagnosis in the last 12 months? Including not applicable if you do not work, and then the number of days. I'll pick 8 to 14. Has the participant needed to quit his or her job due to the health effects from sarcoidosis? For me, it's no. There's also a button for not applicable or unsure. How has the participant's diagnosis affected his or her family's finances? From no financial impact through to severely affected. I'll say slightly affected for me. What is the annual gross income for the household in which the participant lives in US dollars? You can select from the list below. There's also unknown or decline to provide. In general, would the participant say his or her health is excellent, very good, good, fair, or poor? For me, I'll say fair. The participant feels depressed. Never, rarely, sometimes, often, or always. I'll choose sometimes. How often does the participant feel tired? Never, rarely, sometimes, often, or always. I'll pick sometimes again here. Does the participant take any of the following approaches for fatigue? Exercise, so it's was the treatment used, yes or no, and then was the treatment effective? Yes, temporary, no, or don't know. I'll say temporary for that one. And then I'll pick no for the rest of these. How does sarcoidosis affect your daily life? So this is a list of questions down the side here, and then you can answer all of the following with all of the time, most of the time, a good bit of the time, some of the time, a little bit of the time, very little of the time, or none of the time. Please go through and answer each one as it applies to you. Been bothered by headaches? Felt that you need medications to function day to day? Felt that you were full of energy? Experienced mood swings? And on. There's quite a few here, so be sure to read them through completely and answer what's right for you. Okay, so now I've gotten to the end of this section. The next question is, does your health now limit you doing vigorous activities? The answers include not at all, very little, somewhat, quite a lot, or cannot do. What is the ability of the participant to participate in social roles and activities? Again, using the questions down the left side of the screen, you can answer never, rarely, sometimes, often, or always for each one. So, How much does pain interfere with the participant's enjoyment of life? Not at all, a little bit, somewhat, quite a bit, or very much. I'll say somewhat. In the past 7 days, how much did pain from your disease interfere with your daily life? Again, using not at all, a little bit, somewhat, quite a bit, or very much for each question. How has the participant's pain been treated? Please select all that apply. This includes has never had any pain due to sarcoidosis, and a variety of medications, non-prescriptions, narcotics, and more. So I'll say non-prescription medications, and I've tried acupuncture as well. There's also a box here for other. Section 10 should be answered by all patients. It covers whether you have ever been in or interested in participating in studies and clinical trials. Let's review. Does the participant currently participate in any clinical trials related to the rare disease? You can say yes, no, refused, or don't know. This little red asterisk here means that you do need to answer the question. So I'll say no. Has the participant previously participated in any clinical trials related to the rare disease? For me, that's yes. Has the participant donated a sample of blood, tissue, or other biospecimen for research in the past? For me, that's yes. If a biospecimen was donated in the past, what type was it? Blood, saliva, tissue, urine, not applicable, unsure, or other. I'll say blood. What is the name of the hospital or clinic where the biospecimen was donated? You can type it in here, or you can write unsure if you don't know. For me, I'll just write Cleveland Clinic. Oh, my caps lock is on. Is the participant willing to be contacted about donating a sample of blood, tissue, or other biospecimen for research in the future? I'll say yes. Does the participant currently participate in any other registry? You can say yes, no, or unsure. For me, it's no. Is the participant willing to be contacted in the future about research related to their rare disease? Say yes for that one. And did the participant provide information for this registry update? Yes. That's the end of section 10, so now we can move on to the next section. Section 11 moves on to demographics, basic questions that will help researchers see patterns that might appear in those afflicted with sarcoidosis. Let's review. Again, this section is for all patients. Is the participant covered by any kind of health insurance or some other kind of healthcare plan? There's options for yes, no, refused, or don't know. What type of health insurance does the participant currently have? You can select all that apply here. If you're outside of the USA, you can select the categories that most closely resemble what you have. I have private health insurance, so I'll click that. There's also a box for no coverage or don't know. What is the participant's current marital status? I'm married, so I'll pick that. Has there been a change in marital status since the participant was diagnosed with sarcoidosis? Again, you can pick yes, no, refused, or unsure. For me, it's no. How many people, including the participant, currently live in the participant's house, apartment, or mobile home? Select 2. If the participant lives in a group house, how many people live in the group house, including the participant? That includes something like a private residence designed to serve children or adults with chronic disabilities. For me, I'll pick the participant does not live in a group home. If the participant is less than 18 years old, what is the highest grade the participant has started? I'm over 18, so I'll just pick not applicable there. If the participant is 18 years or older, what is the highest grade level of school the participant has completed, or the highest degree the participant has received? There's a lot of answers down here, so I'll find graduated from a college or university. And what is the highest level of education the participant's mother finished? Let's see, high school graduate. There's also refused and don't know. And then again, the same question for the participant's father. For adult female participants, what is the total number of pregnancies, including living children, deceased children, and abortions, both spontaneous or therapeutic? For me, it's 0. For adult female participants, what is the number of live births? Again, 0. And what is the number of living children of the participant? 0. Was the participant born at or close to his or her due date? Yes. And how many weeks away from his or her due date was the participant born? You can select from 2 weeks late all the way through premature, don't know, or on time. How much did the participant weigh when he or she was born? If the birth weight is unknown, please select don't know from the pull-down list. I don't know my birth weight, so I'll have to pull that in. I can always call my mother and come back and edit this later. How does the participant prefer to communicate? Sign language, spoken language, or written language? You can click off more than one here, so I'll pick both spoken and written. How does the participant prefer to be contacted? Email, mail, or phone? I like email. Is data entered by anyone other than the participant? Say no. And did the participant provide the information for this registry update? Yes. Some of these can seem a little redundant, but they're all important. That's the end of this section, so now we can move on to the next. Click next here. And okay, we've reached the end of this section, and the good news is you're almost done. You can click next, and your survey will be submitted. There are just a few more questions to answer, and then you'll be all done.